too young for CO2 lasers? I was at a medi-spa about a year ago, and my nurse had asked me what I was there for. I explained that I was there for Fraxel repair and restore laser, and she stopped me in mid-sentence and told me not to even bother because I was too young. Which then made me start thinking, could I be potentially destroying my young skin if I were to go ahead with the laser? Are there more risks if I were to get it done at a younger age? Would I wrinkle faster? Will I age faster?
Thank you for your question. You describe in your question a scenario where you went to a medi-spa and you met with a nurse who saw that you were scheduled for a Fraxel laser, and this nurse told you that you cannot do it and that you were too young, and then that of course led to several other questions related to the use of lasers and whether you'll wrinkle faster and other issues. Well, I can certainly give you some guidance on how we help people who are younger in our practice, and I'll tell you a little bit about my own experience. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan, Long Island for over 20 years. I've been helping people look their best, especially when it comes to facial aging, throughout my career, and I have used a variety of lasers, including the original CO2 lasers of the mid-90s. So you actually raised an important issue that I deal with a lot in my practice, and I can tell you give you a little bit of understanding of how I see the role of lasers and thermal devices for younger people. To begin with, it's important to understand that the majority of people that we do treat with these devices are people who are dealing with either facial aging changes, which are, of course, age-related, so 35 and older, as well as people who have issues related to sun exposure, or people who have damaged their skin from tanning, from smoking. So in a way, the age is a factor, but at the same time, we have to also think about what is the relative age of the skin. A person could be in their late 20s, but if they were sun worshippers and they worked as lifeguards, their skin will photoage considerably more than someone who is of the same skin type who's 40 years old and has been inside and doesn't spend that much time in the sun. So certainly age is a factor that's important, but at the same time we have many different devices that can be applied in a very specific way, and we can treat, for example, people who have acne scars who are in their 20s. So we always have to identify a problem and identify the least potentially destructive solution and the most beneficial solution. Now, that being said, I have seen an alarming amount of overzealous treatment to people who themselves are overzealous about the minimal issues that they feel are significant. So a bad combination would be a younger person getting in a very aggressive treatment. And I would say that where this becomes very difficult is when a younger person has a procedure that's non-ablative. So if they get a very aggressive radiofrequency procedure, they can be temporarily tightening their skin, but in the long term they may be actually damaging their skin because they have lost some fat volume. They have lost some. May have overheated their skin. So when it comes to dealing with finding a practitioner to help you with whatever skin issue you have, I would suggest that you actually meet with an experienced physician and a person who actually has a lot of experience with a wide range of age groups. And the key is you want to do as little as possible. There is plenty of time for aging changes to occur and to deal with them at that time. there are a lot of options that are not aggressive that you can take. In our practice for younger people, we have something called HydraFacial. HydraFacial is a combination of glycolic acid and water that's applied in a microdermabrasion type technology. It's very safe, it's very superficial, your skin looks better, and there's no permanent long-term negative risk with that treatment in our practice. So I think that this nurse was doing you certainly a service by helping you avoid an unnecessarily aggressive procedure. I think that what you have to do is find the right doctor for you and learn about your options. And I think that the right doctor will likely guide you and try to avoid doing more than you need. There's plenty of time when you're much older to have, or if you have any other issues, to do more aggressive procedures. So I hope that was helpful. I wish you the best of luck. Thank you for your question.